Next, we're going to hear about the ongoing need for plasma donors and how plasma helps those with serious disease. So let's welcome Dr. Toby Simon and Michelle Pecoraro, who is living with hereditary angioedema. Thank you both so much for joining us. And Dr. Simon, let's start with you. Why is donating plasma so important?
As a physician who's treated patients with plasma-derived therapy, I know what a difference it can make in the lives of patients to have these therapies available that are made from human plasma. So it's really important that we have the plasma in order to provide these therapies for patients in need, both patients with inherited chronic diseases as well as in the intensive care situation.
So let's talk about then what conditions the plasma-based therapies treat.
It treats conditions where people are lacking a protein, usually by inheritance or sometimes acquired, that is present in normal plasma. So we can provide that protein or substance in a concentrate that treats the person and allows them to live a normal life. This includes neurologic diseases, respiratory diseases, bleeding disorders, diseases where people have immunodeficiency, they don't have the antibodies to fight infections, and then like Michelle has, hereditary angioedema.
Yeah, Michelle, let's go over to you. Tell us what it's like living with hereditary angioedema.
Well, hereditary angioedema means that I'm missing a protein in my blood. And what this disease causes is extreme bouts of swelling anywhere that blood flows in my body. And those attacks could mean anything from my hands and feet and my stomach to where it's pain and inconvenience, all the way to, if it involves my airway, it could prove to be fatal.
Oh yeah, that is not good at all. So explain why then plasma donations are so important to you and others living with conditions like these.
Well, in my specific case, I lost my father to a throat attack back in the years prior to any therapy being available in the United States. And then it was a journey for me to being diagnosed and then also having those therapies approved. And then my son, also, one of my children did inherit this condition. So it is a family event. And the plasma donations are very critical to us because they literally take what we're missing from our bodies and what causes these attacks. And we're able to infuse that protein, in my case with my therapy, twice a week. I infuse that, and not only does it address those attacks if they happen spontaneously, but they can actually help to prevent them. So for the first time in my entire life, and especially my child who's growing up with this, we can hopefully live as close to a possible normal life as we can.
Yes, that's so amazing that that can help and work like that. So Dr. Simon, who can donate plasma and what are the requirements?
Yeah, basically, normal, healthy adults can donate. There are some special requirements. You do have to weigh at least 110 pounds and be between the ages of 18 and 74. And can't have had a tattoo or piercing in the prior 4 months. Other than that, there are other requirements we go through a health assessment when the individual comes in, but for the most part, healthy, normal adults can donate.
And how does the donation process work? Because I feel like a lot of people, they want to understand that before they even go into the office.
Right. Well, after we do our screening tests and see that everything's acceptable, the individual has a venipuncture, that is a needle placed into the vein, and then the blood flows out into sterile equipment, and it separates the red cells from the clear liquid plasma. And then the red cells are returned to the donor so that the donor does not become iron deficient or anemic, and then we retain the plasma to provide the therapies. We provide a saline infusion at the end to restore the individual's blood volume. And the way this process works, the individual can donate as frequently as twice per week.
Oh, wow. Okay. And Michelle, what would you say to our viewers to motivate them to consider donating?
Well, I know that anytime that they hear that a needle is involved on their end, that can make them have a little apprehension towards that. So I would encourage them to visit the website or visit a local CSL plasma center if they have one. and just kind of make themselves feel better about that situation. It's actually a pretty neat process to witness. And then if they're on the fence at all, I would hope that they would remember this interview and remember that mama that's from Tennessee, and know that they directly impact not only me, but my child and other countless patients that live with these diseases.
Beautifully said. Thank you so much. And she mentioned a website. So Dr. Simon, where can we get more information?
You can go to cslplasma.com, and we also have a center in Jacksonville at 500-12 Norwood Avenue, and you can contact the center also.
I know where that is. Thank you both so much. Michelle, thank you for sharing your story, and I hope that you keep getting your donations and everything's going well for you and your son. And again, thank you, Dr. Simon, as well. And if you'd like to see this interview again, just head to our website, and that's firstcoastliving.net.